Welcome to the Friends of NPACE Podcast. My name is Josh Plotkin. I'm the Chief Operating Officer for NPACE, and I'm very excited today to have Susan Marks with us. We're going to have a fantastic conversation about medical cannabis and medical marijuana in healthcare. And Susan, we can't thank you enough for taking time to join us today. And I think where we always love to start the podcast is having our guests tell our audience a little bit about themselves and how they got into the career path and journey that they're working in. So Susan, I'll hand it over to you to let our audience know how you got into medical cannabis.
Thanks, Josh. It's a pleasure to be here. Thank you so much for having me. So I got into medical cannabis because I'm also a cannabis patient. I've been a nurse forever, for 40 years. I've been a nurse practitioner for the last 5. And I got into medical cannabis about almost 9 years ago. I have a progressive neurological movement disorder. It's called essential tremor. And it had progressed to the point where it was very difficult for me to do any kind of fine motor activities. I couldn't drink out of a glass without the water spilling everywhere. And the treatment, the Western medicine treatment, are anti-seizure medications. And so I was put on primidone, which is a barbiturate anticonvulsant, and it made me so stupid I couldn't stand myself. And I figured I cannot live like this. I need to find another solution. The side effects were just too much. So, as a nurse, I do what nurses do, and I got on PubMed and just started doing some research on treatments for seizure disorders, Parkinson's disease, essential tremor, movement disorders, and cannabis kept coming up. Now, as I said, I've been a nurse for 40 years, and I'm thinking, what is this? I mean, we never talk about cannabis in healthcare, and at least we didn't back then. It's a little bit more popular now, but
Sure.
so anyway, I was quite intrigued, and at first I thought, I was rolling my eyes a little bit, but when I got into the research, I was pretty blown away. And what is a common misunderstanding is that there isn't a lot of research on medical cannabis, and the fact is that there is a ton of research on medical cannabis. In fact, the U.S. government has a patent on cannabis for a variety of different diseases, and I'm sure we'll get into that later. But while I was doing my research, trying to figure out an alternative for me, something that I could live with, um, everything that I read about cannabis was basically it's very non-toxic, it's a very safe approach. And I figured there's, a lot more to gain than there is to lose to, see if I can use this. So, and I've never been a cannabis user. It's not like it was ever on my radar screen. So I really was starting from scratch on this whole thing. But what I did is I after I did all of my research and self-educated myself over months, um, I was able to taper off of my primidone while I was increasing my cannabis dose. So basically, I created a protocol for myself that was primarily CBD. It had a little bit of raw cannabis in there, which is THCA. Neither of those substances are intoxicating. But I did need a little bit of THC. Now, I don't like feeling at all impaired, so I take that at night. And it helps me sleep. I don't have to deal with any feelings of being stoned or intoxicated. And sure enough, so I have been off of my primidone now for about 8 years. I manage my tremors completely with this cannabis protocol. And it's not like it takes the issue away. I still shake a little bit, but it's nothing like what I had before. And I don't have to deal with all of the side effects. And one of the kind of unexpected consequences of this is because I had essential tremor, which was so obvious, you could see me coming a mile away. I was very actively moving. Um, that when I started on the cannabis, I became more still, and my friends and family were obviously they noticed pretty quickly, and they're like, "Oh my God, what are you doing? You seem so much better." And after they got over the shock of me being on cannabis, because I'm probably the most conservative person that you'll ever meet. So the last person you would expect to embrace this type of a treatment, they were like, "Wow, do you think it could help me with all kinds of things? Migraines, chronic pain, insomnia, cancer treatments, all of those things." And that's how I started my consulting business. And I've been doing cannabis consulting now for 8 years. I work, exclusively with medical patients who have conditions that respond well to cannabis. And because everybody is a little bit different in terms of how they respond to cannabis, I help them create protocols that will address their medical needs and fit their lifestyle. Most of my patients don't want to get intoxicated. So a lot of my work is helping them use cannabis without having to deal with that intoxicating feeling. So I spend most of my time working with patients, and I also now teach other healthcare professionals how to do what I do, how to create cannabis protocols, how to work with patients, how to help them get over the stigma, because we've all been told a lot of misinformation, and we've been a little bamboozled by our government, who on one hand has a patent on the medical applications of cannabis, and then on the other hand has it as a Schedule 1 drug. But anyway,
Yes.
I'm sure we'll get into that later. But so that's how I got into it, and it's been the most rewarding field of nursing that I have ever been in, because people actually get better. They feel better. They don't have to deal with a lot of medication side effects and interactions. And there are a lot of very positive uh, kind of sideline benefits of using cannabis aside from just, the medical application.
Excellent. Everything you just said, I feel like there's 10 different directions we can go, and so we'll do our best to do that. I think that, your personal situation, and obviously your profession of being a nurse is a unique one, where what you said towards the end, you have sort of this stigma or this perception of what cannabis is, and what folks have been told about it. And then as you dig into the research and you start to really peel back the layers of the onion, if you will, you discovered that there were some things that made sense as to why you should go ahead and check that out as a treatment option. So that's fantastic. And I think that for healthcare providers that are listening, you talked about your business and the opportunities that you have there, which we'll get into. But I think that's part of the goal of this podcast, is to break down those barriers and those stigmas a little bit. And someone like yourself, who's both a patient and provider, if you will, can give a unique sort of background and experience in a personal journey to be able to share with everyone. So thank you for that. I think the one of the things that we talked about is, you were suffering from tremors and some things going on there. In addition to that, what are some of the most popular medical conditions that you see cannabis effectively treating? Certainly tremors, but what else do you see as it being used for?
Well, cannabis is a known potent antioxidant. So any of your oxidative diseases, your age-related disease, autoimmune conditions, it is also recognized as a potent neuroprotectant. So anytime you have any kind of neurological issues, whether it's neurodegenerative disease, so we use cannabis a lot with Parkinson's disease. We use it with Alzheimer's disease, Huntington's. It's also very beneficial after a stroke or a head injury. The CTE, the chronic traumatic encephalopathy. Anytime you have brain inflammation following an insult, whether it's trauma or a stroke, the endocannabinoid system really steps up to protect the brain. So when you use cannabis following one of those events or as part of your treatment for a neurodegenerative disease, you are helping the brain to reduce the inflammation, reduce the secondary injury that follows a stroke or a traumatic event. So I also use cannabis a lot with cancer patients. Now, when it comes to cancer, we can either use it to manage the side effects of chemotherapy and radiation, the nausea, vomiting, insomnia, anxiety, all of those issues that arises kind of with a cancer diagnosis. Cannabis is also known to be anti-cancer. So it creates apoptosis, which makes the cancer cells commit suicide. It's anti-metastatic. It has a lot of anti-cancer properties. So we can use it as an adjunct therapy. I would never recommend to anybody that they forego the Western treatment of, whatever it is for that cancer and to use cannabis alone. I think that's reckless. But it is a tool, and it's a very powerful tool. And what we see often is that when we use cannabis alongside of the treatment for cancer, oftentimes they don't have to do the full protocol of chemotherapy. They're able to stop it early, which means it decreases the toxicity of the medications, because cannabis is known to have a synergistic effect with the chemotherapy. So you don't need as much or for as long. So it's very helpful as an adjunct. And then, of course, some of the very typical conditions that people will use cannabis for: chronic pain, whether it's neuropathic pain. There are very few substances that have an effect on neuropathic pain. Cannabis, thank God, is one of them. And that's part of its neuroprotective aspects. It's also excellent for sleep. We know how important sleep is. And so if someone's able to go from sleeping 4 hours a night to sleeping 7 or 8 hours a night, it is a game changer for their overall health. It's also used for, I said autoimmune disease, cancer, all the neuro conditions. So it's pretty much everything. If you were to go on and look at the patent that the US government has on cannabinoids, it basically says that it's good for neurodegenerative disease, autoimmune disease, all your oxidative diseases, which, let's face it, that's pretty much everything.
Right.
So, and people are, they kind of misunderstand cannabis in the sense where it does sound like snake oil. Okay. It's like, how can one substance have an effect on so many different conditions? Well, you need to understand the physiology behind our endocannabinoid system, which is what cannabis interacts with as we ingest it. So I don't know if you want to go into that level of detail, but it's fascinating.
It's certainly fascinating. I think from what you just said, that it's a tool in the toolbox, right? There's going to be other medications for certain medical conditions that might be, for lack of a better word, the primary medication. But that cannabis in some way, shape, or form might be able to help minimize the side effects, or might be something that can be used in combination with another medication to assist that patient with the situation that they have. So I think in terms of the endocannabinoid system and the interactions, I think, I don't want to say most people, because as we talked about at the beginning, the stigmas and the mindset around cannabis, I think, has changed over the last 5 or 10 years dramatically. It's not somebody just, smoking a joint and getting high.
Right.
But I think that what you just said, especially from a healthcare standpoint, is important for folks to know. So please do give us a little bit of background in terms of the interaction between cannabis and the human body, and how that all is sort of connected. I think it's important for people to understand that there's legitimate medical research and background that supports the fact that cannabis is an effective tool in the toolbox.
Yeah, happy to. So our endocannabinoid system, and this system was discovered during research on cannabis. So 25 years ago, we didn't know that we all had an endocannabinoid system. So it was through the study of cannabis that we were able to visualize the receptors that are part of the endocannabinoid system, and to identify substances that our body produces that are almost identical to THC and to CBD. So the endocannabinoid system, just like our nervous system, our GI system, um, is our largest neurotransmitting system in the body. It interacts with every other system. Its job is to maintain homeostasis. So if you have a nervous system that's out of whack, if you have an immune system that's out of whack because you have autoimmune disease, your body produces endocannabinoids. So the two primary endocannabinoids are anandamide and 2-AG. Those two substances molecularly are almost identical to THC and CBD. Unfortunately, our body isn't able to produce enough endocannabinoids to deal with all of the things that our body has to deal with, like air pollution, like food that isn't very nourishing, pesticides, all of these different insults that our body is trying to protect us against. The endocannabinoid system does its best to keep everything in balance. Unfortunately, when disease appears, that is basically diagnostic of an endocannabinoid deficiency. So when you take in cannabis, you're basically giving your body the raw materials that it needs for the endocannabinoid system to bring things back into balance. So it works on a very holistic level. So if you have, let's say, autoimmune disease, and you have Crohn's, and your abdomen is inflamed, and you're having all kinds of problems, when you take in cannabinoids, your endocannabinoid system utilizes that in order to decrease inflammation, to improve the functioning of your GI tract, which obviously will reduce your symptoms. It makes you feel better. It heals the gut. And so that's the beauty of cannabis and our endocannabinoid system. We have this plant, it literally grows like a weed on this planet, and it basically produces the compounds that our body needs to heal itself. So I obviously am very passionate about cannabis. It has been a life changer for me, and I'm very grateful to this plant. And I may tend to get a little bit too enthusiastic about it, but most of the people who have experienced the benefits of cannabis feel the same way. I do need to say cannabis is not a silver bullet. It's not going to cure everything. It it works best when you look at everything from a holistic standpoint and you make lifestyle changes in addition to using cannabis. So if you're going to be eating donuts all day and you think you can take some cannabis to reduce your inflammation, it's really not going to work very well. You
Might make
do
you
need
have
to cut
another
out the
donut.
donut. Yes. Sorry, guys, whoever's listening. But yeah, so anyway, cannabis is not a silver bullet, but it really is a wonderful tool for all of us to use for our own health and particularly for healthcare providers to be able to help their patients to use cannabis.
Yeah, I think that thank you for that. And I think having that scientific understanding is very helpful for folks. And one of the things that you mentioned there towards the end is it's not a silver bullet. It's not a cure-all sort of thing that folks can use. And you also talked about sort of the federal government and their stance on cannabis. And I think that's a great thing for us to shift into and talk about a little bit, is that it's on one hand this Schedule 1 drug that is in the same category as some other drugs that I think most at this point would consider harder drugs, for lack of a better word. And then on the other hand, there's a patent for cannabinoids with the federal government. So a few things, and we can go one by one here, but one, why do you think this is still a Schedule 1 drug? Two, can you talk about the sort of changes that have occurred probably over the last 10 years or so, where it has become much more of a state level issue in each state, and how each individual state is approaching things? And then three, for patients that are in geographical locations where there are more restrictions and barriers to access, what are some of the things that those patients and providers can do to help themselves, given the situation of where cannabis stands as a classified drug in the country? I know that's a lot, so we'll tackle it one by one.
Okay. Okay, no problem. So, so it's important to understand that over the last 20 years, things have changed a lot. So in 2018, we had the Farm Bill. Basically, the Farm Bill allowed for hemp. Now, hemp and cannabis are the exact same plant. The only difference, scientifically, the only difference is cannabis, according to the legal definition, has more than 0.3% THC in it. So hemp has less than 0.3% THC in it. So the only compound in the cannabis plant that's considered a Schedule 1 drug is THC. So there are 140 other cannabinoids in the plant. So THC is a cannabinoid, CBD is a cannabinoid, and there are 138 other cannabinoids. All of those are considered hemp and can be sold over the counter, can be shipped across state lines, have no restrictions on them because they are considered hemp. But if a product has more than 0.3% THC, it has to be sold in a dispensary in a legal state. So some people think, well, I live in an illegal state, so cannabis isn't available to me. That what's more accurate is THC is not available to you. All of the other cannabinoids are, thanks to the Farm Bill of 2018. It can be shipped to you across state lines. So I work with people all over the country, and they don't even have to be in a legal state. They'll get benefit from using all the other cannabinoids with the exception of THC. Some people they have something that really requires the THC, and we can get into how they can access that. But so that's basically the distinction between what is considered a Schedule 1, which is just THC, and all the other cannabinoids and compounds in the cannabis plant. So even if you're in a completely illegal state, you still have access to hemp. So, and when we talk about how things are changing, the Department of Health and Human Services recently sent a letter to the DEA saying we'd like you to reschedule THC from a Schedule 1 to a Schedule 3. So 3 is like tramadol and I can't remember the others, but it's obviously less restrictive. What that's going to mean for the cannabis industry, we have no idea, because there are no other Schedule 3 drugs that are sold in a dispensary or any other kind of retail operation. So it's a big kind of question mark as to where we're going to go if THC gets rescheduled from a Schedule 1 to a Schedule 3, but we'll just have to see. So in terms of the states making their own decisions in terms of, is this going to be legal recreationally? Is it only going to be legal medically, or both? The federal government basically has left it up to the states. They have really eased up on their law enforcement against users of cannabis. They're still out there trying to kibosh the black market, which is where they need to focus. And I'll do a quick little public service announcement here. If you buy products in a legal dispensary, you can be assured that those products have been lab tested, that there are no pesticides, no heavy metals, no molds or other bacteria in the products. But if you go to an illegal dispensary, you have no idea what you're buying. And so just avoid going there. If you happen to live in a state that does not allow recreational or medical, but you border a state that does, a lot of people will just go to the other state. And then, I'm not telling anybody to break the law here, but
for sure. But I also
so,
think you're saying that something that needs to be addressed is that, they're depending on where you live, it's very different in terms of access, and what you might be able to do and not do. So I think it's important for folks to understand that.
yeah. Yeah. And, most of my clients, they want to avoid the high. So I'm teaching them how to use hemp basically with 0 to no THC in it. Um, and, you can get a really good response without needing to be in a legal state. You just need to find somebody like me who understands the plant and the compounds in the plant and how to use it appropriately. So, so I think I covered everything. Did I cover all 3 of your questions?
I think you did, and it makes sense that, there's patients that are looking for this to be something that helps them strictly medically, and I think that there are other patients or people who are interested in marijuana for let's call it the recreational use, to, for lack of a better word, enjoy the effects of it. And so I think, to boil it down a little bit more, for the patients that are looking on the former of what I just mentioned and really looking for it to be a medical tool for them to help with the condition that they have. Can you talk about what that process looks like for a patient and their provider and how they explore starting to use cannabis as a treatment option for them? Like, where do you
Sure.
start? How does that work? But do you have to get a medical card? All those sorts of things.
Okay. So we'll first talk about the provider-patient relationship in terms of cannabis treatment. So, It's obviously very similar to any kind of provider-patient relationship. You need to get a complete medical history. I need to know what diagnoses I'm dealing with, all the medications that they're on. I check for any interactions because the cytochrome P450 enzymes in the liver are the same that break down cannabis as a lot of other medications. So you need to be aware of that and which drugs it could be an issue with. For example, Coumadin. So if somebody's on Coumadin and they're taking particularly CBD, it's going to interfere with the liver's metabolism of the Coumadin. So your blood levels of Coumadin may rise if you are constantly taking in CBD. The body identifies CBD as something of its own. So it will prioritize that in terms of metabolizing it. Any other pharma drug that is synthetic, the liver will get to that after it's broken down the CBD. But in the meantime, your Coumadin levels could rise. So things like that you do need to be aware of as a clinician. You also want to know what their goals are. So are they their goals for cannabis therapy? So cancer is a great illustration. Somebody may come to me with a new diagnosis of cancer. They just want help getting through treatment. They want to know that they're not going to be puking their guts out for the next 6 weeks. Other people want to use it as its cancer fighting properties, and those are two very different protocols. So identifying what their goals are for the cannabis treatment will determine the protocol. You also need to know their past history with cannabis use. People will think, oh, yeah, I used to smoke cannabis back in the 70s, and, I'd smoke a whole joint, and, that would kind of set me up for the night. Well, the cannabis today is very different than the cannabis that was around in the 70s. Because it's been prohibited for all of these years, growers, their main market were the people who were using it recreationally, and they were after the high. So growers would clone plants that had higher and higher levels of THC. So cannabis now is extremely potent. And so you need just a very little bit of it. So when you're working with somebody clinically, you're trying to find the very lowest effective dose. So you go through a whole dosing protocol where you start with a low dose and you slowly, incrementally increase it until they get the response that they're looking for. The other thing that you want to keep in mind when you're working with somebody is you need to educate them on the legalities, on the practical aspects of having cannabis in your home. So if you have pets, if you have kids, you need to store it appropriately. You need to understand that, let's say you live in California and it's available pretty much on every street corner, and it's kind of very accepted and easily accessible. If you walk into a post office in California and you have a joint in your pocket, you could be arrested because you're on federal land. So whether you're at a post office, the airport, a national park, even though you're in a legal state, if you pull out cannabis, you can be arrested and put into federal prison. So these are all of the kind of the legal practical things that patients who are embarking on a cannabis therapy need to be aware of. So I have a cannabis agreement that goes over this and more things, just so that they don't get themselves into trouble because they're trying to manage their medical condition. So that's pretty much the starting point of working with somebody. Then you have to develop the protocol based on their medical issues, and then, put it into place and, go through the whole dosing protocol that I just mentioned a minute ago. And then based on their response, everybody responds differently. So everybody has to go through the same process I went through to figure out what was going to work best for me. You have to try different things, different products, different methods of administration. I typically don't use the inhalation method just because it's irritating to the lungs. And most of the medicine gets blown out with the smoke. So I typically use more tinctures, more capsules, more topicals, suppositories, a lot of different forms of administration. So you have to figure out what's going to work best for them and then figure out the schedule of taking the medications. And yeah, there are other nuances that go into it. But basically, you're trying to create a program that's going to work for somebody's medical issue as well as their lifestyle.
Excellent. You answered the next question that I had, which was what are the preferred methods of consumption for patients? And it sounds like staying away from the smoking side, if you will, is something that you would recommend. Can you talk a little bit about I'm not sure if people are familiar with, I think going back once again, people think cannabis, smoking go hand in hand, but there's all these different resources that are available. Can you talk a little bit about the tinctures and edibles and topicals and furthermore, what medical conditions in which consumption or treatment methods sort of align with one another, if you see any correlating things with that?
Yes, absolutely. So there are, a number of different ways you can consume the cannabis. And depending on the medical issue, for example, if you just have a sports injury, let's say you injured your shoulder, you may be able to get away with just using a topical because you have one joint. You have a lot of cannabinoid receptors in the soft tissue throughout your entire body. So when you use cannabis topically, it's going to last for a couple hours, but it will need to be reapplied. But you may be able to get away with just using it topically. On the other hand, if you have osteoarthritis or if you have rheumatoid arthritis and it's a systemic issue, you're not going to be able to get away with just using topicals. So oftentimes I'll use topicals as well as, for example, tinctures or tablets. Tinctures are basically the cannabis plant material that's suspended in oil. So cannabis is it works in it's fat soluble basically. So they will suspend tinctures in oil that you just put a few drops or a dropper full underneath your tongue. You have a lot of blood vessels under the tongue, so you will get some immediate absorption, and then you swallow it. The benefits of using the tinctures is you have better bioavailability. So compared to the inhalation method, so you take a hit off of a joint or a vape or whatever, most of this medicine gets blown out in smoke. You have very little bioavailability. However, you get immediate onset. So there's always a caveat to, I don't normally recommend inhalation. If somebody's going through chemo and they're barfing their guts out, you can't give them a tincture. You can't give them anything by mouth. They're just going to throw it up. So if you give them a hit off of the flower with a joint or the vapor, you're going to get a response in 15 seconds or less. So their nausea goes away, and then they can take in the tincture. So as a rescue medicine, the inhalation method is great. As an ongoing way to manage pain or nausea or anything like that, it's not ideal. But this is where the tinctures come in because the inhalation method is immediate, but it only lasts for an hour or two, and then you have to re-administer, versus a tincture where it takes longer before it takes effect, but it will last for 6 to 8 hours. So if you have chronic pain, you can take a tincture and get relief for 6 to 8 hours, which is a godsend. There are other methods, including suppositories. Now, I actually use suppositories a lot with my cancer patients. So suppositories are great because you can use very high doses of THC and you won't get the same level of intoxication as you do when you take it orally. So when you take cannabis orally or you take THC orally, when it goes through the liver, it gets metabolized from delta 9 THC to 11 hydroxy THC. 11 hydroxy THC is much stronger than delta 9. So whenever you hear somebody saying, "Oh my God, I had the worst experience with cannabis. I got so high, I didn't know what to do with myself." 9 times out of 10, it's because they had an edible. So what happens is they take the edible, 20 minutes goes by and they're like, "I'm not high yet. There must not have been anything in this." And then they take more. It can take up to 2 hours for it to get through the liver and for you to start feeling the effects of it. So by the time it gets through the liver, they not only have taken way more THC than they should have, but that THC has now been converted into 11 hydroxy, which is twice as potent. So then they have a very bad experience. And in terms of, I should probably just say this so people won't worry about it. If you do overdose, or not overdose, but overdo it on the THC, there are a number of things that you can do to bring yourself down more quickly. Number one, chew on about 4 or 5 peppercorns, full peppercorns. Peppercorns have a cannabinoid, and it's also a terpene called beta-caryophyllene that actually blocks our receptors in the brain that THC attaches to. So if somebody overdoes it, give them some peppercorns. It will block those CBD receptor or the CB1 receptors, and it will help you come down faster. There are also products out there. One of them is called Undo. It's oleic acid, which also blocks those receptors. You never have to worry about, "Oh my God, I feel like I'm dying." You're not going to be dying. Nobody has ever died of a cannabis overdose. Believe me, the scientists have tried with monkeys to overdose them to the point of, figuring out what the fatal dose is, and there is none. I think the latest thing I read was you had to consume 1,500 pounds of cannabis in 15 minutes in order for it to kill you. So if you do overdo it on the THC, the best thing to do is just stay hydrated, stay relaxed, sleep through it if you can, and it'll be over in a few hours. You'll never do it again. We'll be so uncomfortable that it'll be like, if you're still open to using cannabis after that, but you'll know that dosing is one of the most important criteria in the success of using cannabis, whether it's recreationally or medicinally. So I think I answered your question. I kind of got off on a little tangent.
No, it's great. And I think I've been at NPACE for 8 years, and we have had the fortune of speaking with folks such as yourself and others about medical cannabis. And I don't think I've ever heard in a presentation or education from some folks that have been with us at our events talk about some of the things that you just said. If you feel like you've overdone it, that there are actually a few things that can sort of help you come down from that. So I think people will find that very interesting. And going back to what you said a little bit before that, is that it's, the consumption method for each patient is going to be different based on their personal medical condition and all of that background work that you talked about earlier in the podcast, where having that complete history, knowing, does this person already use cannabis in a recreational way? In thinking about that, is it something that's brand new to them and they're, they don't really have any education in terms of what the benefits could be. So all of that work that a provider is doing, I think the deeper that they can get and the more understanding that they have, that they can then go ahead and properly align the treatment method for that particular patient. I don't think it's, it's not situation X is automatically drug Y, where there is some things like that in the medical space. This is situation, could be anything as to why this patient might be a candidate for cannabis. And then from there, really having to figure out what makes the most sense for that individual patient. So, and I think that's a great segue into some education and resources that you have for providers and for patients. And obviously it's sort of your full-time career, and what you do day in and day out is helping not only patients, but other providers learn about the benefits of cannabis and how that they can be in a similar position as yourself as somebody who can help their patients. So can you talk a little bit about DearNurseSusan.com, what you have going on there, some of the resources that are available, and the continuing education opportunities that you have as well?
Yeah, that'd be great. Thanks, Josh. So, as I mentioned earlier, I do train healthcare providers as well as really anybody. You don't need to have a license in order to do this. As a licensed healthcare professional, I would really like to see more licensed healthcare professionals getting into this. So just so that patients have more access and they have really good guidance, rather than at this point, their only option is to go to a dispensary. Nobody at a dispensary knows what to do for Crohn's disease, let alone fibromyalgia or cancer. So the more healthcare professionals that we can get as part of at least having this as a tool, that if their patients ask them, what do you think about cannabis? Do you think cannabis would help me? They'll be able to really give them some good guidance. So if anybody's interested in learning everything that we've talked about today, plus more, I have an online continuing education program. Right now it's approved for 43 and a half hours. And it's a digital program, so you do it at your own pace. And the program itself also includes weekly coaching. So I get on a Zoom call with all of my students every Monday night, and we talk about particular patients, we talk about different products, we talk about changes in the laws, we talk about just about anything related to cannabis consulting. So so I want my students to always feel like they have a team behind them, like they have somebody that they can go to with questions, etc. So so anyway, if anybody's interested in learning more about that, I'm happy to get on a call with you. You can go to my website, schedule a call. It has more information about the program. And not only is this beneficial for patients that healthcare providers know this, but it's wonderful as a healthcare provider to be able to give people solutions that are non-toxic, that are easily, incorporated into their lifestyle. It allows them to reduce their polypharmacy. I have so many seniors who have been able to use cannabis and get off of their pain meds, their anxiety meds, depression, their sleep meds, their anti-inflammatories, to be able to remove 5 pharma drugs and substitute one cannabis tincture that does all of that for them. It's wonderful. And so I know I keep singing the praises of cannabis, and I don't want to sound like you know, like a biased, healthcare provider, but really, I encourage you, if this is at all interesting to you, we're just scratching the surface. The potential for cannabis is really amazing. And, most healthcare providers, particularly physicians, are scientists. And being able to be introduced to something that is applicable in so many different medical situations, as well as being non-toxic, is really, it's a wonderful thing to be able to talk to your patients about. So
awesome. That's a great way to summarize everything. I think what you said there in terms of polypharmacy and drug interactions, and especially for folks who are on multiple medications, that, for them as a patient, and if you're a provider that is prescribing these medications, for folks to potentially think about this as an alternative in your treatment plan for those patients is something for folks to think about. And as you just mentioned, this podcast, we did a great job, I think, of covering the big topics, if you will, but there's much more that people can sink their teeth into and really dig deeper than we were able to today. So once again, highly encourage folks who have found this episode interesting to check out Susan's website, which is dearnursesusan.com. And as she mentioned, you can go ahead and schedule a call with her, check out the different resources that she has. We're hoping to work with Susan and bring her to an NPACE conference later this year, hopefully, or at the very least going into 2025. It's crazy we're already thinking about that, but we are. And so we're hoping that Susan will be able to join us and be able to educate the nurse practitioners at NPACE conferences as well. Susan, any parting words, anything else that we think folks should know before we sign off today?
Well, I'll do another public service announcement. So products are very important, and there's a lot of products that are sold over the counter. You'll be able to identify the highest quality products based on those that do third-party lab testing. Do not use any products where you can't go to their website and look at this. It's called a COA, Certificate of Analysis. And you can actually see that this has been tested, so there are no pesticides, heavy metals. Because the thing about the cannabis plant, it's a bioaccumulator. So if there's any toxins in the soil, it gets sucked up into the plant. And then if you ingest that plant, you're ingesting some things that can be harmful to you. So there are a lot of products out on the market. Most of them are not lab tested. We really have no idea what's in them. But there are products that are very high, basically medical grade, that clinicians use. So if you hear somebody say, oh, I had a bad experience with cannabis, I tried it, but it didn't work, or CBD, or you need to do a little investigating on the products that they use. So that was one area that we didn't get into, and it's a very important thing to keep your patient safe and to use the best products that are out there. So, but aside from that, I am so excited to have been on your podcast, Josh. I'm happy to speak at I'm happy to talk about cannabis anytime, anywhere. So you just tell me where to go, and I'm happy to talk about it.
Well, we can't thank you enough for taking time today to be with us. I think we're going to have both patients and providers that tune into the podcast find this extremely educational and beneficial. And really, I can't thank you enough for, I think, as I've said a few times, just the lens that cannabis and some of the stigma behind it, that we were able to hopefully break down some of those walls that folks may have experienced previously over the last 45-ish minutes, however long it's been. But I think that it's going to prove to be something beneficial, and I'm certain that folks will also reach out to learn more from you. So thank you so much, Susan. For our audience tuning into this episode, we can't thank you enough. We hope it's been an educational and informative one for you. A few final reminders to folks is that the Friends of NPACE podcast can be found on all of your favorite streaming platforms, Apple, Spotify, as we are also on YouTube in video format. So feel free to check out this episode and all of our other episodes in video format on YouTube, and subscribe to the NPACE channel on YouTube. If you're in need of continuing education credits, a few of our podcast episodes have that. We encourage you to take a look at the podcast, which is also hosted on our Learning Center, which is learn.npace.org. Just type in the Friends of NPACE Podcast into the search bar, and all of those episodes will come up for you. And you can view all of our continuing education opportunities that are online at learn.npace.org. And as we mentioned, Susan will hopefully be joining us at an in-person conference coming up later this year, where you can find out more about where we're going to be later this year on npace.org, and click on that Programs and CE Conferences tab for more information. Upcoming events are posted right on our homepage. So lots of different ways to engage with continuing education with NPACE. And we can't thank Susan enough for being with us today. So this will conclude this episode. Stay tuned on our social media channels for updates on everything NPACE. And that will do it for today. Take care, everybody. We'll see you next time.